So, Mr. Smith, from what you've told me about what's been happening to you and from my examination, I think you've got a flare of your gout. Would you agree?
I know, it's really pain again.
So, before we start talking about treatments, I just wanted to make you aware of a study that we as a practice are recruiting patients for, and that's the CONTACT study being led by Keele University. Would it be alright if I tell you a little bit about it to see if you'd be interested in taking part?
Yeah, and I think I had something through the post a while ago about it.
Yes, I hope that you did. We've been sending information to all of our gout patients because this is a trial that is looking at which is the most effective treatment for gout from naproxen and colchicine, either of which you may have received in the past, to look at which is the most effective but also which is has the least side effects for patients. So believe it or not, gout's been around for such a long time that nobody's ever done a direct comparison of these two medications. So that's really why we're looking to find out how from here on it's best to treat patients with acute gout like you've got. Okay.
So I'm happy about that, yeah. Anything to do to help?
So the trial would basically involve a 50-50 chance of you being allocated into either group.
Okay.
So we would just need to check that you've not had any adverse reactions to either the anti-inflammatory naproxen or to colchicine in the past.
Okay.
But also we'd need to check that there were no reasons why you couldn't take either of those medications.
All right.
But in theory, if you were okay and happy to go into the trial, then we would ask you to complete a questionnaire today about your symptoms, and then we'll give you some questions to take away to complete over the next 7 days starting tomorrow that you can either do on paper or you can do online, and then we'll ask you to complete a final questionnaire at 4 weeks' time. Okay.
And will I know which tablet I'm on?
You will know, yes, absolutely you will know. For safety reasons we need you to know, so that if there were any problems or you had any questions that you had that knowledge and you were able to ask or raise any issues. Okay. So you will know. And I will know as well, but I won't be able to control your allocation into either group. So if it is that you've had colchicine in the past and you've been unable to tolerate it, or if it is that you've had naproxen in the past and it's, for example, upset your tummy, then we won't be able to declare you as eligible for the trial.
All right. Okay.
An important thing for you to know before you think about consenting to going into the trial is any risks to you. Now, obviously, because naproxen is an anti-inflammatory medication, its main side effects are that it can sometimes cause indigestion or heartburn, stomach ulcers, or at worst bleeding from the lining of the tummy. Very occasionally it can cause rashes, skin rashes as well.
Even if I just take it for a few days to get the gout better?
It's a lot less likely if we use it at lower doses for less time, and it is a very rare side effect, particularly for short-term use, because you'd be using it for 7 days. But we have to warn you that that is possible. Okay. Colchicine, the most common side effect is that you'll experience a bit of a tummy upset. Some people have diarrhoea, some people feel a little bit sick, and very occasionally people are sick with it. However, these side effects are mostly, again, experienced when we use it in higher doses and for longer periods of time. So actually we'll be asking you to take a low dose regime just for 4 days. Okay.
And what happens if I get one of these side effects, like the diarrhoea?
If you get a side effect, if it's something that you have experienced with the medication before, know that it's tolerable and feel happy to continue, then that's absolutely fine. But if it's anything that is new to you, that you're unsure about, or you just want to make sure that we're aware of for the trial purposes, you can either report it directly to us at the practice or straight to Keele CTU, which is the trials unit that are managing the study.
Right.
And I would be able to give you all the information for that in a study pack if you do decide to take part. I think it's also important to say that the risks of taking part in the trial, because all we're doing is giving you a medication that we would have used anyway, there are no additional risks to taking part in the trial compared with me treating you as I usually would. It's just that the decision about which treatment to give you will be made for me rather than me making it myself. Does that make sense?
Yeah.
So we're not giving you anything that we wouldn't have ordinarily, and we're not giving you anything that's going to cause you any adverse effects or side effects that may not have happened anyway.
All right.
Okay. So having heard all of that, and knowing that it's completely voluntary whether you take part, and it won't make any difference to my treatment of you apart from the randomisation. How do you feel about taking part in the study?
I've tried them both in the past, and I'm happy to help work out which is better than the other.
That's wonderful, thank you very much. So I'm just going to use my study information to help guide you through the next, guide you and me through the next part of recruiting you into the trial. So the first part is going to be the eligibility. So whether there is any reason why you can't take part in this trial. Okay, so I'll show you the form as I'm filling it in. So I'm going to put your initials here, Mr. Smith, and your date of birth. Could you just confirm that for me?
8/10/54.
That's super, thank you very much. Okay, so to be included you must be a male or female aged 18 years or over, which we know that you are.
Yeah.
You must have a current attack of acute gout,
Certainly
which you do. Ooh. And you must have the capacity and willingness to give consent and complete the paperwork, which, having discussed the information with you, I believe that you have. Okay, so to be ineligible, you would have to have an unstable medical condition, for example, abnormal liver function or unstable angina, for example. Now, looking at your medical records, I don't think that there's anything like that in your history, do you?
I haven't got any problems at the moment, no, apart from this wretched gout.
Excellent. Okay, so I've looked at your last kidney function tests and they are well above the level for the exclusion criteria, so I know that you can go in for that reason. You've not had surgery in the last year, and I don't know that you've recently had any bleeding in your tummy.
No.
And you've never had a tummy ulcer.
No.
You don't take any blood thinning medication, do you?
What, you mean like aspirin or things?
Like aspirin, warfarin, or the newer medicines like apixaban, those sorts of things.
No.
I know that I don't prescribe them to you, and it would be very rare that somebody did without me knowing, but I need to check. Okay, so you haven't had an allergic reaction to either aspirin or anti-inflammatories like ibuprofen in the past?
You mean like getting a rash all over the place, or?
Anything really, a rash, nausea, vomiting, tight chest, anything like that?
No.
Okay. So you've not had any side effects that have made you unable to tolerate the medication, so not allergy, but for example we talked about colchicine where you may have diarrhoea.
No, I didn't actually, no.
Okay. And I don't know of any other contraindications to either naproxen or colchicine. For example, you're not an asthmatic, are you? So we know that that's okay. I need to check whether anybody else, for example, whether you'd seen an out-of-hours doctor and been prescribed either colchicine or naproxen in the last 24 hours before you came to see me.
No, I'll come straight to you, doctor.
The other thing that I need to check is that you hadn't got some in the cupboard and you've taken one in the last 24 hours thinking you'd start it before you saw
they all got used up on the last attack.
Jolly good, okay. So you're not a pregnant or lactating female, you're not a potentially vulnerable individual, and you've not previously been in the trial. Are you involved in any other clinical trials or product tests that I don't know about?
No.
Super. Okay, so I think that makes you eligible to go into the trial, so I'm going to tick yes. I'm going to put my name, completed by me, and sign, and put the date, which is the 11th. Thank you.
Pleasure.
Okay, so that's the eligibility form.
That's for me then?
That's for me, this one.
Oh, right,
that's the eligibility form complete. Okay, so you mentioned that you'd had the information at home about taking part in the trial.
Well, it was a bit of a while ago, yes, but it was about along the lines of what you described, one against the other sort of thing.
Yeah, so I've got a patient information leaflet here for you to read through if you want to refresh your mind about the details of the trial.
All right.
So if I give that to you to have a little...
And do I need to read it now, or can I read it afterwards?
I'd like it if you could read it now, that would be super,
right.
And that way I know that you've had all the information for me to feel confident that you're happy to go into the trial.
Right, okay.
If you'd like to take it outside, have a sit in the waiting room and read it for 5 minutes, that's fine, I'll pull you back in.
My goodness, there's a lot of here. Yeah, all right. Yeah, I've had a look at that, doctor, and it seems all right.
Jolly good. Okay, are there any questions that it raised for you? Anything that you want to ask me about the procedure? So obviously you'll complete a questionnaire for me today.
Yeah.
I'll give you the questionnaire to go away and complete for the next week, starting tomorrow, either paper or online, and then you'll complete another questionnaire in 4 weeks.
I guess it was only what happens if it doesn't get better on the tablets that you're going to give me.
Absolutely, and I think it's important that you complete the questionnaires as you ordinarily would. Whether it gets better or not really is a matter for you and I to discuss, so I'd hope that you would come back and see me.
All right, so I'd come back if it wasn't getting better.
Yes, please. But I think also the other thing to mention is that as part of the trial, the study investigators are asking that you grant permission for them to look at your health records here at the surgery so that they can see if things like that are happening, if people aren't getting better or they're having to consult for other reasons, side effects from medication or persisting or recurrent symptoms, those sorts of things.
So will they know who I am then when they look at it in the study people?
The study people won't know who you are because your records will be allocated. There will only be one form that links your name with an anonymised number. The study people will see the number and there will only ever be one form that links your name with the number. That will be stored completely separately from all of your information.
Okay. All right, okay.
So the idea is that we keep it anonymous and confidential.
Good.
And the details are only used for research purposes.
Right, okay. Yeah, no, that's fine.
Okay, fine. Any other questions about
No,
the study?
I don't think so. No, I'm just keen to get some treatment.
Sure, I can imagine. Okay, so can I run through the consent form with you then? So, I have to confirm with you that you've read and understood the information leaflet that you've sat and had a look at. That's wonderful. So I need to ask you to initial clearly in the box next to the question. Not tick, initial.
Yeah.
That's wonderful. Okay, so I've had the opportunity to ask questions and received satisfactory answers.
Yeah, that was fine.
Okay.
I understand taking part in research involves completing a baseline questionnaire. Yeah, that's okay. Before the consultation. Okay.
Yes, I'm going to run through that with you once we've agreed that you've consented. This bit is about that you understand that I can't control which medication you're going to be allocated to, so there's a 50-50 chance that you'll end up with colchicine or naproxen.
Yeah.
Okay. That we'll ask you to complete the 7-day pain diary starting tomorrow, either online or on paper, according to your preference.
Right.
And that you'll then be asked to complete a 4-week follow-up questionnaire, again either on paper or online.
Okay.
You agree to my GP, me, being informed of participation in this trial if I were not your GP, so it's for people who have consulted either out of hours or seen someone they wouldn't normally. I agree to an authorised individual from the research team reviewing my medical records, as we just talked about, for safety information, anonymised and only information relating to the trial. Okay. I understand that my participation is voluntary. Importantly, that I am free to withdraw at any time without giving any reason, without my medical care or legal rights being affected.
Okay.
Okay. And so I voluntarily agree to take part in the above trial.
That's a lot of things, isn't it?
It is signing your life away. That's wonderful. So if I can get you to print your name there. Date it. And sign. And I will do the same underneath. That's wonderful. So that's consent to join the study. Thank you very much for that. That's wonderful.
Right, good.
So, if it's okay with you, we'll run through the baseline questionnaire now.
Okay.
Okay, hopefully this will take less than...
Do this now?
We do have to do this now before you're randomised.
Before? Oh, right, okay.
So that the treatment that you're randomised to cannot in any way affect the answers that you give to start off.
All right.
Okay, so I'm going to give you my pen.
Thank you.
So we're going to ask you to write in block capitals, circle or cross where appropriate, okay?
Okay.
So, first question. In the last 24 hours, how severe was your worst gout pain? 0 being no pain, 10 being pain as bad as you can imagine.
It's pretty bad. I'll give it an 8, I think.
Okay. And is this the first time you've suffered from gout?
No,
I know it isn't.
No.
Okay. How old were you when we first diagnosed you with gout? I think you were about 52.
I think I was, yes. Yeah, sounds about right.
Okay. Could you indicate which parts of your body are affected by the gout?
At the moment?
Yes, yeah, at the moment.
Just today?
Yeah.
Or it's just down in my toe again, isn't it? Yeah.
That's wonderful, thank you. So for each of the next questions, tick the one that best indicates how you are today.
Oh well, walking's not so clever. Oh, that's not too bad. Oh, I'm going to have to do much later. No, not very intense. Well, this is quite quick, isn't it? It's not bad. So, male. Well,
that's super. Thank you very much. That's excellent. Right, so I will keep that one. So now we're going to randomise you into the trial. We'll be able to give you your prescription.
I'll get some treatment.
Okay, super. So, Mr. Smith, you've been randomised into the naproxen group.
Oh, right, okay, yeah.
Okay,
yeah, quite happy with those.
So you take 750 milligrams to start with, which is 3 tablets, and then you take 250 milligrams 3 times a day after that.
Yeah, that's what I did last time, I remember, yeah.
Okay, so I'm going to ask you to take them after food to minimise the chance of indigestion and stomach ulcer. The other thing that I'm going to do, just having a look at some of your other medications, it looks like you might be on other medications that when combined with the anti-inflammatory might make it more likely that it will give you indigestion and heartburn. So I'm going to give you another tablet called a PPI, a proton pump inhibitor, to protect your tummy just for the duration of the naproxen.
Yeah, I know what you mean by that,
Okay, so I'm going to give you a prescription. When you cash your prescription, do you pay for your prescriptions?
No.
Okay, I was going to say, if you do pay for your prescriptions, keep the receipt and there's a form in your pack so that you can claim the cost of it back.
No, I don't now. No.
Okay, fine. So, any final questions that you want to ask me?
No, I don't think so. So I'm going to have a pain diary.
Yep.
And I'm also going to have to do out this questionnaire which they're going to send me, is that right?
That's right, yeah. So, I'm going to give you your study pack. In it is your information leaflet for your future reference, your copy of your consent form to make sure that you're happy.
Yeah.
And here is the pain diary that we talked about with a stamped addressed envelope to send it back.
All right.
So we'll ask you to fill this in every day starting from tomorrow.
Right.
So tomorrow will be Thursday the 12th.
Yeah.
So I'm going to pop that date up there just to remind you. Okay. And it says quite clearly at the bottom, if you have any queries at all, please telephone Liz, the contact trial coordinator, on that telephone number.
Right, okay.
Okay.
And what have I got to do inside it?
It's very similar to the questionnaire you've just filled in, but it's about side effects, what you're taking, and
just
how you're
same
feeling.
every day?
Yep, same every day.
Do I have to do it at any particular time in the day?
If you try and do it at about the same time each day, it will give you a kind of accurate 24-hour picture of how things are. But again, it's going to ask you about the worst pain that you've had.
So the same time as we are now each day?
Roughly, yes, if you could, that would be great. We don't mind too much. We'd rather that you do it than think, oh, the time's passed, I'll leave it for
Perhaps
today.
At the end of the day then?
Yeah, that would be fine. That would be perfect. Okay, so that's your study pack.
Right, very good. And let's hope this gout gets better.
I do indeed. All right, any problems, you know where I am.
Thank you very much.
Okay, you're welcome.